we are seeing that the patients, after they are delivered, discharged of the hospital, they have a long difficulty about the lung and respiratory recuperation. And I would like to know if you have thought the same situation in China patients, and how may I help this group of people, because they are very difficult to recuperate. They are doing a physiotherapy, respiratory physiotherapy, but it takes so long time. So I'd like to know if you can help them with another different things from the experience from you.
那么现在就是我们从这个
So if you count back to the January, right now we have a certain number of patients already discharged from the hospital. We don't have right now a very sound foundation for us to share with you. I would like to share you based on my personal observation. So let's first talk about the 80% of the patients with mild symptoms. For this group of people, you know, when they were admitted in the hospital, actually they were in the makeshift hospital. So for them, they don't have any difficulty or really minor difficulty in breathing or making activity. So you saw like the media coverage by CGTN, like they dance in the makeshift hospital, like they could also play Tai Chi. So they not really have big problem. So after 3 to 4 weeks stayed in the hospital, and we check once again their CT scan, and their image shows that they improved a lot. So because this is a respiratory disease of COVID-19, but we didn't give really the additional lung function checking for these group of mild symptom patients. So based on their like gesture and movements in the makeshift hospital, so we got feel, and also based on our observation, like these patients are good enough. So after these patients discharged from the hospital and back home, they will successfully and in a very short time back to their normal life and behave just like a very healthy person. So that is the 80% of the mild symptom patients. So they don't have really big sequelae after they discharge from the hospital. And let's also talk about that 20% patients with critical condition or severe condition, because these group of COVID-19 patients actually the multi-organ damage. So not only to their lung, also to their heart, also to their coagulation system. So after this group of people discharged from the hospital, our suggestion is that they do not have really big movements when they're back home. So for our suggestion is for this group of 20% critical yield patients, after they're back home, we suggest them to stay really in the calm condition, don't really have a big physical exercise for 3 to 6 months, because still they're not really 100% recovered, especially to their lung functions or their heart functions. So for these group of people, if they have really big physical movements, that may cause VASCD. So for the 80% patients with mild symptoms, we not really worry about them. But for that 20% patients, because they still have a failure in their myocardium, so we not really suggest them to have a big movement. They can do some recovery therapy. We also have some practice in this regard, but still, that's only more for the principal guidance. So for these group of people, we suggest them to go to very professional rehabilitation hospital. That's my answer.